Able-bodied people do things that are hard all the time. It's not easy to climb Mount Everest, but people push themselves and they do it. Now, maybe our Mount Everest is getting a plate off the bottom shelf of an upper cabinet, but that doesn't mean you shouldn't try to do it.
No. We're doing trauma. Or medical. Either one.
It's one or the other.
Don't film this. Okay, it's my first one. You are gonna hate me.
I'm gonna hate you.
Yeah. Where are we setting up at?
I got my camera right here, so you can just
Wait, where's your camera at? Oh, right there.
Yeah, you can sit right there if you want.
Okay. All right, you ready?
Yeah.
Your dispatch information? You are dispatched to a, how old are you, Ken?
26.
You're dispatched to a 26-year-old male that was just in a car accident. Oh, I forgot to tell you one other thing. All right, CJ, come back. Okay, dispatched to a motor vehicle accident. Guy ran off the road and struck a tree. You may begin whenever you're ready.
Okay, so I'm gonna determine that the scene is safe, apply proper PPE. If he's on the highway, is it gonna be safe?
It's safe.
Okay, cool. Right away, is he the only patient?
He is the only patient.
Okay, I'm gonna consider C-spine because it's a vehicle accident.
Okay.
I see why you have the chair. He's actually in the car.
He's in the car.
Oh, God. Okay. General impressions. What do I see? Are you breathing? Hello, sir. My name's CJ. I am an EMT. How are you today? Nothing. No response?
Not great.
Not great. How is his skin look?
As it's presenting. Pink, warm, and dry.
Pink, warm, and dry. I see that he's having adequate chest rises, or is it bilateral?
Good bilateral chest rise and fall upon visual observation.
So it is good. Wait. Yeah. Okay. Well, sir, do you remember what happened?
No.
No. Looks like you're at the side of the road. You smacked a tree. Is there any pain anywhere?
Yeah, my right ankle.
Your right ankle? So you can feel in his feet, so it's not necessarily done. Is there any other type of complaint that you have?
Huh?
Is there anything else going on? Is there any other problems besides your ankle? Can you feel your left one?
Yeah, but just my right ankle.
Just your right ankle? Okay. Well, so his airway's good. Breathing is all right. Circulation's fine. His ankle's the only thing, and he has a decreased level of consciousness. I'm gonna give him oxygen.
Okay. You can just verbalize what you're going to give him and how much.
Okay. Can I also stabilize his, verbalize that as well, stabilize his neck? I mean.
Yep. So you've already told me to do that.
Okay. I didn't know if it was just like, you have to actually say I'm gonna do it, or if I
No,
have to just say I'm considering it. Okay, I'm gonna call backup ALS, request additional help. We're gonna get you to be okay, man. I'm gonna take your blood pressure and pulse so I can figure out what's wrong with you.
Okay, and blood pressure comes back at 120/80. Your heart rate is, hold on a second, I gotta write this down actually. 120/80. Heart rate comes back at 72, and your respirations come back at 12. And shallow. Any other vitals you'd like to obtain?
The oxygen meter.
Pulse ox, you have them on oxygen, that comes back at 100%.
100%?
Yep, because you have them on oxygen.
Okay. Maybe I should have taken that pulse beforehand in case of carbon monoxide. So,
Yeah, 5 minutes left in your assessment.
signs and symptoms, it's just the right ankle and you're not feeling too well in the head?
Yeah.
Yeah? Are you allergic to anything?
No.
No? Do you have any medications that you're taking currently?
Yeah.
What is it?
I don't remember.
You remember the medications? What about past medical history?
I'm diabetic.
You're diabetic? Okay, good to know. And you're feeling a little woozy?
Mm-hmm.
Yeah? When's the last time you've eaten, man?
I think yesterday.
I'm gonna be considering glucose.
Okay.
I think you actually need some right now. Does this look familiar to you?
Mm-mm.
Okay, what I want you to do, if you can, I want you to take some. You can do it right now for me. Right on. Alright, we're gonna keep going. Alright, buddy, I'm gonna start, while that starts getting to your system, I'm gonna start working on your ankle, and at that point, hopefully medical ALS will come and help me out some more. I'm gonna call it, I don't know what else to do.
Okay, so you're doing really good. You start going strong, right? Which shows me that you've been studying your sheet, you know what you're supposed to be doing. You hit the big thing. I give you the crappiest one, because it's both the trauma and the medical wrapped up into one. He had a hypoglycemic episode while driving. That explains the altered level, right?
Yeah.
And then when he crashed, he broke his ankle. And so that's going to be the ankle pain.
Well, I thought he got a concussion because he crashed into a tree.
Yep. And so it could present like that, right? The one thing that I would ding you on big time is you gave him medication without knowing if he needed it for sure.
Oh.
He's a diabetic, didn't eat until yesterday, but we don't know his blood sugar yet. You never checked his blood sugar levels. So
You're right, I should have
you
done
know,
that. Glucometer. That's why you asked, is there anything else you want to take? And I did the
So if you would have done your glucometer,
Yeah.
I would have told you, oh, he's 62 sugar. Oh yeah, give him the sugar, right? And then once you do that, you do your head assessment, right? Let's see if he did have a concussion. Let's
See
check
battle
pupil
signs,
response, battle
raccoons.
signs, raccoon eyes. Do you have your teeth? Do you feel like you bit your tongue? Because if they bit their tongue, okay, this could possibly be a seizure, but he also crashed, so.
You got the two papers. I was going down one and I was like, oh wait, it's this one.
Yeah.
Oh, wait, no, it's this one.
Yeah, so then you check his neck, his back, you can have him sit forward. One thing that you did say is, at the very beginning, you said, consider spinal immobilization, so I gave you the hash mark, or the point for it. But then later you're like, oh, I do C-spine, do you want me to do that? So if it was an automobile crash, oh yeah, definitely. Just say, I'm gonna take C-spine.
I guess my question was, do I need to put it on it?
No. So that's something you can pass off to your partner. So
Okay.
when you actually are being tested, you'd be like, hey, I'm gonna pass off C-spine I'm gonna take C-spine precautions, I'm gonna pass it off to my partner to perform. And then the tester will more than likely be like, okay, it's being performed.
Okay, because
All
I was
right.
like, do I
I would like to get a glucometer reading, I'll pass it off to my partner, and then they'll pass it off, okay, your partner just came back to you, your glucose reading is this. So those are things you can pass off to to a partner. Your sample was good. Like I said, you were going through the list pretty dang straight on. You weren't doing
It was fun to watch.
You weren't doing the shotgun approach as much as these other two.
Mm-hmm.
So you went pretty good. And then once you got to that, okay, I think I know what's going on. I'm treating it. Where do I go from here?
Yeah, I didn't know. I was
Just
lost
continue
at that
down.
one.
Okay, you corrected that problem. Is there anything else we need to check for? The way I can tell is by doing my head to toe. Oh, I need to split that ankle because it's broken. So I'll split that. Okay, now I'm gonna go en route to the hospital, type of a thing. Make sense?
Yeah.
So you actually did really well, except for your glucose meter.
Yeah.
Your glucometer you didn't check. But for a really hard scenario, you were on the right train of thought because you identified both problems, medical and trauma. You just need to finish your rest of your assessment.
What was the E?
Events.
Events leading up to this.
Yep.
And then L is last.
Last order one.
Last order.
Okay. Good job, guys. Any questions for me?
I need to do this along.
on that sheet.
Yep. And the one thing I will say, if you look at the trauma assessment, see how it has these little asterisks?
Yeah.
Has someone explain those to you? Maybe integrated within sequence of primary survey. So, say you're checking them and they have bleeding from the abdomen, you can come down here and do your abdomen assessment without losing points.
Oh,
And then you come back up here and you finish this. And so when we do, whoever taught you how to do the trauma, did they teach you the rapid blood sweep type thing? Where you just like touch them head to toe real quick?
Where you like sweep.
Yeah. So pretty much right in here, your airway, breathing, circulation those are critical. So those are critical, but you can work these into it up here. But on your medical, you can't do your stuff, your secondary assessment as part of your primary. Where here in trauma, you can, if it's pertinent to it.
I forgot to check the pulse.
Yeah.
I gotta do that right away.
Yeah, that's
okay.
critical though.
Yeah. Dang.
So, other than that, pretty good.
Okay.
Ready? Can you do it again? Yes, you're so cool. Who's it? Who's the girl?
That was pretty rad. So what are you thinking?
So what is that box here for anyways?
What? That box right there? I don't know. Is it the side part that keeps it in?
Did you get rid of it?
Every time life gets a bit shady, I'ma look up to the sky and thanking for these blessings of life and these dreams of mine. Dreams of mine. Every time life gets a bit shifty, I'ma look up to the sky and thank him for these blessings of life and these dreams of mine. time to go. 'Cause I know that my angel's looking out for me. If I go on this, I will be, I'll be protected in this journey of mine, in these dreams of life, of these dreams, for these dreams of life.
You realize you don't have an extension cord, right?
What?
You don't have an extension cord for your trailer hookup.
Oh! I'll have to buy that with my Trump bucks.
Your Trump bucks? Is that what you're calling your trailer?
Yeah.
So were you impressed with Mila's jumping? Like that she was willing to do that?
Mila's jumping? Yeah, I was impressed. She trusts us, but she also trusts her skills.
Pretty good.
I stay all late. I'm looking, I see trouble I entertain as I go down this city of fate. Life is a beach, sets a days away. As it goes down this old broken road. Life is a beach, man, he'd rather play in the snow. As he goes down this city of lies, wondering who is the man he needs to defy. As he goes down this old broken road, life is a beach, man, he'd rather play in the snow. I can't do it like this. This angle's hard.
Shout out to Baby Kangaroo for teaching me this bad boy on his Instagram. Okay, that's not the one I wanted to do. I wanted to land it, show I was cool. That was not cool. That one.